Good evening and welcome to our Monday Night Live. We are happy that you are here, and we do look forward to another interesting topic this evening where we can get into one that even considers children and how we can bring value to their lives, for their precious lives that God has blessed them with and put us within their space. So before we continue, let's have a word of prayer. Heavenly Father, we want to give you thanks for this day, and we thank you for yet another session that we're about to have. We pray that your name would be glorified in all things, that the information being shared and discussed can benefit many who are in so need for such this detail. We ask that you bless our presenter and all those who will be attending. This is our prayer in Jesus' name, amen. Okay, so I am just going to take us through our opening. So our topic of discussion today is looking at autism. Autism, all that you need to know, what parents need to know, or even guardians, teachers, Sabbath school teachers, church leaders, and what impact can diet have on autism? Amazingly, diet has a lot of impact on autism, and we would be discussing that as well. And just want to let you know that we're talking to you from Pure Wellness Lifestyle Center, located all the way in Trinidad and Tobago. And autism in children and what every parent needs to know. So we have a special invited guest, and that is Shasta Green. She is an occupational therapist, and she works with children who are autistic or have other kinds of conditions. And Ms. Green is going to tell you more about herself and the services that she offers to those locally within our body of Trinidad and Tobago, and even her far-reaching extent. She's also a co-author of a book, and I think I saw it. Did I see the book here? Yeah, right on on my library. Waiting in the pit. So some of you may have come across this book, and yeah, so she's also in there as well. So she's going to tell you a little bit more about herself and then get into the presentation for today on autism, and I'll come around to the end on the diet piece. And of course, do ask your questions. You can post your questions in the chat as we discuss and share. And we will again have at the end a Q&A session. So I'm going to stop sharing screen at this time. And Sister Green, if you have a slide pack to share, you can proceed to do so.
Thank you very much, Dr. Nash. Thank you all for being here. Thanks for those who came early. Thanks for those who came on time. And also thank you for those that are soon to come. Excuse me.
All right, just let me say one thing. It's that though we see, we don't have everyone that are able to attend the live sessions because they're tuning in from different countries. So the session will be posted on YouTube, and then you get a larger number of viewers at that time.
Okay, fantastic. Dr. Nash, just let me know if my volume is good, as well as what you're seeing on the screen.
Yes, your volume is good. We're seeing the screen. I guess you're sharing from your phone. If you did it the landscape way,
yes, thank you for that reminder. I forgot. Landscape portrait, nice. All right, is it better?
Oh yeah, perfect.
Awesome. Thank you so much. Excuse me to one and all. Thank you for being here. As Dr. Nash said, my name is Shasta Green. I am an occupational therapist. I have a master's in occupational therapy. I also have specialized training in dealing with children who are picky eaters. I absolutely love working with children. I absolutely love the picky eaters because I can move them from M&Ms to actually eating from the family pot. All of this is possible because God and I work together. As I tell many of my parents that I work with, I ask them first if they're religious, and if they say yes, I know how to tailor the conversation. I said, parents do their best, I do my best. There are things that only God can do. So I thank God for this opportunity to share with you. As Dr. Nash rightly said, any questions, any comments, you agree, disagree, put it in the chat. So at the end, we can have a healthy discussion and share. How did I meet Dr. Nash? I know her in 3 different capacities. The first one is she was my teacher. So I met her when I did the medical missionary training during COVID. The second second hat we wear is she is also my naturopathic doctor. So I go to her. And the third one is when I was looking for a place to practice occupational therapy, I was changing location. I was at the wellness center for some time. So I really enjoy those 3 interactions with her. And the fourth one is she's also my church sister as well. We are both Seventh-day Adventist. Let's get right to it. Does my child have autism? The 3 letters, excuse me, ASD. What do they stand for? A, autism, S, spectrum, D, disorder. It is a developmental disorder that affects communication in children, their social interaction, as well as their behavior. The reason why it says spectrum, it's because there used to be, for example, Asperger's syndrome. So they had different diagnostic descriptions. Then they put all of them together as autistic spectrum disorder. And for autism specifically, they would have different levels, levels 1 to 3. The lowest level says the child needs, the lowest level says the least amount of support the child needs. Level 1, least support. Level 3, most support. What are the common early signs of children with autism? There is a delayed speech. Usually by about 12 months, you will get some form of babbling with children. You realize, okay, my child is not meeting their development milestones to say, excuse me, dada, mama, please, yes, come. All right. So that's going to be, you're going to look for that. Second early sign, there is limited or there's absent use of gestures such as pointing. If a child wants a toy, they can point to the toy, just in case they don't have the words yet to say toy. If a child wants to go outside, they can point to the door, just in case they don't have the words to say door. And sometimes they try to say oi, or, but they're pointing. A child with autism may not have those skills. Also, their social reciprocity is usually reduced. Children would play together in each other's space, looking at each other, laughing, taking a toy, giving a toy, sharing. Children with autism, they tend to prefer have what we call parallel play. They play alongside a child, or they just prefer play by themselves. And the next early sign is repetitive behavior. They're doing things over and over. They have a toy, they may hold it in their hands and flip it different ways, left and right, twisting the wrist in order to look at it. They may sit on a chair, they may rock, or they may sit and rock. Some of them, they may flap their hands. Some of them, they like to jump and flap their hands. So you find there's a behavior that they do repeatedly. These are common early signs of children with autism. I'm going into more detail with the social and communication delays. They have social interaction delays. Again, as I said, they prefer play by themselves or alongside children as opposed to playing with a child, and that is called dyadic play. They also have difficulty understanding social cues. For example, they tend not to know very well safe space. Okay, so if we're talking to someone, there is at least maybe arm's length, the forearm length of a distance, the child with autism might be right up into your face. And if you are talking with the child and you're not happy with what's going on, you don't like what's going on, they tend to miss the facial expressions of happiness or sadness or annoyance or come play with me. So these are things that they would have to learn. Communication delays, they would have difficulty with nonverbal communication. When we as adults speak to each other, we hear what people say, we also see what they are not saying. That's a challenge for children with autism. They're not able to pick up, this child doesn't want to play with me. They're not able to pick up that I am too close to this person. Unless if, and I am going ahead a bit, unless if it affects them personally, then definitely they would move away from a situation. I mentioned pointing, there's a difficulty in pointing, even with waving. By 12 months, you wave at a child and the child would wave back. Sometimes the children with autism, when they see you wave, it's as if they are looking through a mirror. So they imitate what they see, which meaning their hands would be facing them, the palm of their hands would face them, and the back of the palm would face you. So they're waving. Usually it is the opposite way, or sometimes they won't wave at all. That can take some time to come. And they would have limited or absent pretend play. So it's difficult for them to be abstract in their playing, and at times they have difficulty imitating actions. That's a big thing with children. When their imitation skills are strong, that also helps them to foster relationships. Continuing, they are sensitive to sensory stimulation. Sometimes they're overstimulated, sometimes they're understimulated. So the input that is coming to them. We know the five senses: hearing, seeing, tasting, touching, smelling. There are two other senses, three others. There is the vestibular input, which is balance and knowing where you are. There is the proprioceptive input, that is your body position. So if you are walking next to someone, you could feel if that person is too close to you or if you're close to them, and you adjust accordingly. There is also the word is slipping me, but interoceptive, right? Sense, this is where your internal organs will speak to you and let you know something is right or wrong. For example, if there's a pain in the lower back, sometimes it might be you're not drinking enough water. So it is said that your kidney knocks and says, hey, give me more water. Or if your throat is dry, it could be that you are thirsty. So children with autism, when the bladder, for example, is filled, instead of, as it relates to potty training, instead of holding and then let's go learn to potty, they would just let it go. So that's some of the challenges that they have. And they also have unusual reactions to pain or temperature. Sometimes they're oversensitive. Once there's a change in temperature, they know, or sometimes they're under sensitive to temperature. They won't even realize that if something is too hot or too cold, which can be a challenge for them because the information that's coming to them through their senses, it isn't raising an alarm, or even if it is, they are not acknowledging it. So that is a challenge that they would have. And those challenges can also be strengths as well because they are more sensitive. So if something is wrong, they would know, as well as they're not bothered as easily if they're under-responsive. So they could come across as being more patient. And as time progresses, that skill is turned into that strength. They learn to harness it better as they grow older, of course, depending on their level of ability to receive information and to comprehend information. Continuing with some of the challenges that children with autism have, their repetitive or restricted behaviors, some of which I mentioned before. They like spinning, so that's the vestibular input. They want to receive more, or they like rocking. They like to feel where their body is. Sometimes they have a strong preference to behaviors like flipping a light switch on and on, or sometimes they play with a particular toy over and over as if that toy just doesn't lose any interest to them. Sometimes they flap their hands, sometimes they will jump up and down, sometimes they will play with a particular toy in the same way. Sometimes they will line up their blocks or their toys or their cars in a long row, a horizontal row. The strength of that is they're really neat. So they like to see things in order. So you're using that repetitive behavior of them in order for them to be neat. So you're encouraging that. And then there are times where you would use that same repetitive behavior to sort of to change it intentionally so that they can learn to be able to adjust to spontaneous behavior. Obsessions with specific topics, objects. There was a child I was working with last week, and he can be easily distracted. So we're in the therapy room and he heard something on the outside and he's asking me, what is it? I am intentionally not answering him and redirecting him to what the task at hand. I said, let's get back to the task. He kept on asking the question over and over because he wanted me to answer so he could then continue his work. Eventually, he followed my lead and I answered the question and I quickly went back to the activity that was in front of us. The spinning and the rocking, those are repetitive movements, and they can be very rigid when it comes to routines. So the strength is there's a routine, they will follow it. So they know how to create good habits and they will stick with that habit. Life at times, not at times, but life is spontaneous. The routine can change. You wake up in the morning and it's raining heavily, so you're not able to leave at the time you're accustomed of leaving. We can adjust to that as adults. Children with autism is a challenge for them. Example, a parent would come to me at a certain time on a certain day. The child is aware that when we come, we're going to Miss Green. When they come into the office, I'm ready and waiting to take them to the therapy room. If they come and I am not ready for them, they're not pleased. They may cry, they may have tantrums, they may want to come see me, they may stay Miss Green. And I say to the parents, all of those things are good because it's teaching them that in life, things may not go as it always does, but we could still adjust. And whenever they do adjust, even if that adjustment is for a second or a minute, there's always a congratulations. Good job, Shasta, for waiting. Nice waiting. There are developmental red flags for autistic children. Sort of like a recap of what I would have shared earlier. There will be developmental motor skills. Children are supposed to crawl at a particular age. Once you see that milestone is not being met, you're observing. They're supposed to walk by 12 months. Once you see some might walk earlier. And even while I'm on the point of walking earlier, there's some children that would not crawl or they wouldn't crawl for long and they walk earlier, and parents are happy for that because, hey, my child is walking. That is good. One of the challenges is because they missed that stage of crawling where they would strengthen their upper body, their upper arm, their forearm and their wrist and their fingers, it could lead to challenges later on as they develop because their hands may be weak. Nevertheless, the child meets the age for crawling, good. Walking, good. No difficulty with coordination, good. But once you notice these challenges, they're crawling later than they should, they're walking later than they should, they're not able to take an object, hold an object, release an object from their right hand across from their body to their left side. Once you notice those coordination challenges, it says that there's some form of developmental red flag. They will also have difficulty with joint attention. Again, pointing to an object that they want, or pointing to somebody that they see. You notice children in preschool who are developing typically, daddy, mommy, miss, and they're pointing and they're happy and they're looking. Children with autism, daddy's coming, mommy's coming, miss is coming, and sometimes it's as if they're not recognizing that their caregiver who they're accustomed to is there. Of course, they would see them like in maybe a second look, but the acknowledgement of that adult figure isn't there. So you're seeing these challenges. They are not able to play with the toy, or they don't play with it appropriately. They're not giving you the proper eye contact. They're not giving the eye contact with children. Either they have difficulty sharing. It's all about them. Yes, children, for example, who are probably raised alone, they have difficulty sharing. However, in a shorter time, you could teach sharing. Children with autism, sometimes it takes longer in order to teach sharing. What is the type of therapy that you need in order to get the help for your son or your daughter? Usually there are two therapies that are recommended once a child is diagnosed with autism: speech therapy and occupational therapy. The gentleman at the bottom, he's a speech therapist, and I was intentional to put it because in the world there's male and female speech therapists and occupational therapists. In Trinidad, of course, the males are less in these two fields, but they are still present. So we do have male occupational therapists in Trinidad. How will they help your child with autism? They will improve their verbal and nonverbal skills, which will help them in socialization and interacting with persons. They will improve their comprehension skills. Some children with autism, they can recognize words very well. However, the comprehension skill is poor. A speech therapist will help with that, as well as the social pragmatics, which are the cues that persons give that a child with autism may miss out on. The speech therapist will work on that. For occupational therapy, we're working on joint attention and social interaction, getting their attention with what is presently in front of them, as well as to be able to have that one-on-one interaction with somebody else, which is very important for children as they develop. Working on their fine and gross motor skills. Fine motor skills, for example, handwriting, tracing, coloring, to button, to unbutton, to zip your jacket or to unzip your jacket, as well as gross motor skills, throwing a ball, catching a ball, kicking a ball at a target, allowing the ball to come to you and to be able to stop it. Their daily living skills, brushing their teeth, combing their hair, potty training, removing the jersey, putting on the jersey, removing the socks, putting on the socks. All of these are part of a child's development, teaching them independence and building their confidence in self, as well as promoting social play. The greatest occupation of a child is play. Occupational therapy is helping persons do what they want to do, need to do, or expected to do. And different diagnoses can affect that. A child wants to play, but because of autism, they have difficulty with social interaction. A child needs to be able to eat a healthy diet, but because of autism, maybe, no, not autism, but they might be picky eaters, that's going to be a challenge. A child is expected to listen and follow instructions, but because the child might be oversensitive or over responsive or under responsive, they have a challenge in receiving that information and carrying out the instruction. This is where occupational therapists come in, so that what the child wants to, needs to, and is expected to do at their developmental age, they are able to do it. Even if they do it differently, the goal is that they are able to do it. There are screening tools for early diagnosis of children with autism. The common ones are MCHAT, Modified Checklist for Autism in Toddlers, as well as ADOS, Childhood Autism Test, Autism Diagnostic Observation Schedule. Usually the ADOS is one that a professional does. The MCHAT, a parent can actually go online and look at the questions and to see whether or not their child is at risk for autism or showing signs of early autism. The importance of screening is you actually know, okay, I see something wrong with my child. What is it? It may not be autism. It could be ADHD. It could be a learning disability. So if you think it's autism and you do the screening and you realize, okay, the child doesn't meet the criteria, then it tells you it's something else. So what is that something else? You could now speak to your pediatrician, whether at the government facility or private facility. The pediatrician can then refer you to a developmental specialist. There an assessment is done. Another developmental specialist is a physician who has specialized in that. There's also child psychologists that are specialists in order to diagnose your child, as well as an educational psychologist. It all depends on the findings of the pediatrician who then refer you to the developmental specialist. But educational psychologists, while they can diagnose a child, usually if it's a learning disability, they would go to the educational psychologist in order to have a more tailored intervention for the child in the academic setting. In conclusion, the first step, as it relates to parents who have a child they think that might be autistic, you, the parent, you are the expert. So you're the first person, you're the first responder. You're seeing that something is wrong. Then there are screeners to see whether your child is at risk for autism. Third step, you talk to your pediatrician, who can then refer you to a developmental specialist, which is the next point, either private or public. All in all, your child being at risk for autism, your child having autism, isn't the end of the world for the child or for you. It is something that is usually sad for parents because that's not what they want, that's not what they expected. They go through that grieving process of not having a typical child. After the grieving process has ended, there comes acceptance. My child is still a child. He or she just learns differently. And these are the resources in which you can get the information, more information on what I shared. If you would like to have a soft copy of resources that would go along with this presentation, I would send my number in the chat so that you could send me a message and say yes for resources, and I would get that over to you. I thank you all so much for your time.
Thank you very much, Sister Green. Thank you. I have a question. Is there any connection between genetics and autism, that it could be connected in some way, of course?
I like that question, and I'm usually nervous when I'm answering that question, not the parents. Why? Because of what I was taught. And I'm happy that Dr. Nash is a naturopathic doctor, so I see it as a safer space. Nonetheless, I'm going to share it. In school, we were taught that there is no cause for autism, but there are contributing factors. For example, the age and the health of the parents, the genetics is mentioned, but not as a cause. So probably mother or daddy may have had a child with autism, and you might see that happening in the generation. What I have found with my clients through my 6 years of experience is I always ask the parents, and I'm very intentional, I always ask them, when did you notice the signs? Usually 2, 3. And if I have to put a figure to it, let's say 6 or 7 out of 10 of the responses, one of the main things they say to me when they notice the changes at the time of having to get childhood vaccination. And they said, hey, when the child took the vaccine, that's when I saw the changes. The development was delayed, their speech, they were no longer seeing daddy and mommy, the pointing, they were not giving me eye contact. And the reality is, though the physicians will say, no, that has been disproven, every medication has a side effect. So that alone in itself is something to look at. And I also, many years ago, I was looking at a US government conversation that they were having as it relates to mandatory childhood vaccination and the increase in autism. And one physician said, since childhood vaccinations became mandatory, he noticed that there was an increase of children with autism. Of course, there are persons who don't fall in that category, like myself, like my siblings. We got childhood vaccinations and we're fine. How do I answer that? We respond to medication differently. I hope that I would have answered that question.
Yeah, quite interesting. All right, and for the occupational therapy, it helps them to do, but is it that it brings about a change entirely in their behavior, or they have to be on this continuously?
No, it all depends on, excuse me, the success of a child is first the parents seeing that there is a problem and they're getting help. As it relates to occupational therapy, it is how does the child interact with the therapist? And 3, are the parents going to do the continued work at home? So minimum 3 months, a child can come for therapy depending on the goals. The goals I worked on, it's achieved with 100%, 60%, 60 to 100%. And the parent can continue therapy at home and they could return at any time. With occupational therapy, within 3 months, you can expect to see the child more regulated, meaning they are more receptive to, they have more attention. When the child is more regulated, they're more attentive. So they are more receptive to receiving instruction. They're more receptive to follow instructions. I would do sensory, occupational therapists do sensory play with them, which is play with structure, with steps, so that they're able to follow through with a task. Their handwriting will improve, their potty training will improve. So whenever the challenge is with the parent, developmentally, minimum 3 months of occupational therapy, you will expect to see changes with the child. And the parent who does the occupational therapy homework, there is quicker advancement with the child. And some of my parents, they are so happy with the child's development, they want the child to stay with me. So they don't want to be discharged and wait for something and come back. They say, Ms. Green, the child is doing well, let's just continue. Of course, finances is real. Whenever parents come to see me as an occupational therapist, that is a financial investment they're making in their child, and I'm benefiting from it. So I always say thank you to them because it costs. So by 3 months, I am very intentional to pump as much as I can into the parent and the child, because I understand that financially it's not possible to continue possibly past 6 months or even a year. Because as I said, usually children also need an additional therapy, for example, speech therapy.
Right. Right. Okay, and so you mentioned that you help change picky eaters into full plate eaters and happy eaters. And so in part of that change, the content, you said from M&M's the full food. So
Mhm.
the content change, do you see, and we're going to talk about this more shortly, but do you see some sort of improvement? Is it that you guide them along the healthy eating pathway and they make that shift? And then there's added improvement there?
Yes. So usually parents are freaked out by the child is like in M&Ms or snack. And sometimes the family members, they are not, they look at it and say, spoiling your child. But no, they said food entering the mouth or close to the mouth, how it smells, what it looks, what it feels like, what it tastes like. It's an aversion to it. It's a food aversion to it. So when the parents come to me, I always say to them, this is where your child is. They're eating M&Ms. That's okay. At least something is coming in. But they just want tea, and then preschool, 3, 4 years, it's okay. As the child's palate becomes more, and their eyes and their fingers becomes more receptive to different textures, different temperatures, then we can reduce what they like, what they have a strong preference to, and you can introduce the healthier options. So some parents may come to me and say, the child doesn't eat any meat. I say, that's fine. They'll be fine. There's legumes. The parents may come to me and say, oh, he loves meat. He's a meat mouth. Because I'm a medical missionary, I also take the opportunity to share a healthier way of living with the parents, but I'm very careful of when I introduce it. So if they say, yes, the child loves to eat meat, okay, let's begin, but they don't like fruits or vegetables. So we're starting off with fruits to get them more exposed to it, the scent, the texture, what it looks like. And as that exposure expands, I can now say, okay, let's give them more fruits. Let's give them more vegetables, so little by little, you nudge them through.
Mm. All right. Have you seen where, for what you know a healthy diet to be, children coming in from the onset with such a healthy diet?
If children come in with a healthy diet,
Yeah.
yes, some of them may only like, some of them just like dal and roti. Some of them like macaroni and cheese. Some of them just like rice and chicken, but it's limited to a particular starch and a particular protein. So the parents want more expansion.
Mhm.
One of my greatest expansion was a child who he was 10. He didn't have autism, but he was a picky eater. And he just liked macaroni and cheese, and that's what he'd go to school with. He now eats seafood. And that was a big stretch for me, from moving from macaroni and cheese to now wanting to try seafood. So it's really a journey as to where the taste buds will take the children. The main focus is getting them accustomed to wanting to try something new. Then little by little, you can begin to expand it to something healthier, which is also easier on the parents. Instead of having to cook a separate meal, my child will eat what I cook.
Right. Okay. Let's see. We, uh-huh. All right, good. So wonderful, thank you. So we'd go on now to share in about the other aspect, looking at diet. And for those who are on the platform, if you do have questions as we go through and reflect on what you've already seen, please put your questions into the chat box, as well as you can hold them towards the end. But the sooner you get your questions in, of course, we are always ready to answer. Right, so let's have a look here. We're looking at early intervention, even with this condition, the earlier, the better, the greater opportunity you have for leading the young child into this space. And so for nutrition, introducing faith, nurturing, caring for them can make a profound difference. So some of the foods that I would suggest that can contribute to, poor eating habits as well as neurological states will be to address from the gut. The gut and the brain is closely connected. So anything that could improve gut health and as we also saw that the environmental factors, what's inserted, injected, consumed by the child can have an impact on them. So for healthier options, we're looking at gluten. That comes from wheat, barley, and rye, having higher numbers and higher value of gluten in those food items. They tend to cause behavioral changes in sensitive children. So if the child is already autistic, by them consuming gluten, they can be amplified in their situation, or by removing them, as we're suggesting here to avoid, you can find a more relaxed state. Casein, as found in dairy, is linked to inflammation in neurodivergent children. So any form of milk, dairy, in cheese, butter, we want to avoid those items. So whereas an occupational therapist may make suggestions, these are additional pointers that the parents can take on and to try to carve out a path dietarily to support their children. And it can only benefit you. It would not hurt to put this to the test because it does have connection between what is consumed and behavioral or mood types of behaviors. The colors, artificial dyes, so colors found in red, yellow, the blues and the greens and all of these things, different types of snacks that may carry these colors, artificial dyes in them, tend to affect the brain, and they also worsen hyperactivity. So if we can sort of pull away from these colored foods and go instead for nice, brightly colored fruits and vegetables. Now, children are most times attracted to colors, and with an autistic child may or may not be attracted to the colors, but that's one way in which the industry would use to attract children. So apart from taste, so let's see if we can move away from getting all natural colored foods by the variety of fruits that you introduce. We also think about refined sugars and processed snacks that tend to have mood swings. I have watched this with children. Like I had my test piece in the form of my nephew. He's all grown up now, but when he was younger, and if he had a class party, some other child, they bring these party bags, and he'll come home all excited and just want to eat. And if you don't watch him to stop on that, he'd eat out the entire bag in one evening. Of course, by the next day, he has runny nose, coughing, some inflammation, mucus buildup in his respiratory tract, as well as the behavior can be really off, not quiet disposition. And so we've watched, the consumption of these artificial dyes and refined sugars and processed snacks and so on, and see that it affected his behavior, and he was not autistic. So it goes for children across the board that these things can impair their judgments, their behaviors, their moods, and their thoughts. Now, the dietary recommendation would be to focus on eating plant-based whole foods diet, avoid what we just spoke about, the gluten, casein, artificial colors, preservatives, and animal foods as well. I tend to say to individuals that the plant foods are more calming. You don't see any tomato tree attacking another tomato tree, but you can see one chicken attacking another and one cow attacking another, you know. So in the plant kingdom, the foods are more calming. And we want to look at fruits, omega-3 seeds also for consideration. All right. We all then look at a whole food plant-based plate for our children. And as you can see on this side, we have our fruits and our vegetables, our plant protein in the varied forms of nuts, and there are a variety of nuts and nut butters, or even seed or legume butters, such as in hummus. And you can take, you know, hummus is made from garbanzo bean that's blended up, and you put your seasoned flavors in there and you all blend it. But you can also have any bean and have a blend as well, and use that as a protein base to add to your children's food. So they may not see the bean, but they can see this paste, and they may just gravitate to eating it. So there are things that you would need to change up and try getting the nutrients in them in different ways. Whole grains, there are a variety of different whole grains, and water is your choice for drink. So how could we have kid-friendly tips? How can we move our children to a whole food plant-based diet? Number one, identify plant-based foods that the family already enjoys. So if you have apple slices, you have burritos, serve them more often. So it's healthy, you know, like a wrap like this. It's a wrap, especially if you have a nice sunflower seed dressing in here. It could taste so delicious. And they may just like this and want to have it every day. Well, you pack all the different veggies and fruit items inside of there, and you just get them all nourished up. Then you can gradually introduce your family to new foods by pairing them with some familiar favorites. So say that they like this, you can have some cucumbers on the side, a side portion, or you can have a side portion of avocado. You can have something else that you can add to them, to the favorite. Another is to keep fresh produce in a bowl or on a counter at eye level in the fridge, so that the first thing you or your children can reach out to if you want to eat, at least they're able to grab healthy as opposed to grabbing something that is unhealthy. Of course, eating patterns would be to eat at set meal times, and that could also help them mentally as well. But that may not always go well. So in the event that they're grabbing for anything like a snack in between, at least let it be like a fruit. Stock your pantry with staple ingredients that can be assembled into quick meals. And so you always think about that. You may have like a rice pasta, you may have you can have like some avocado, cucumbers. So you just have things that you could quickly pull together. You can have some tofu that can be quickly prepared. Have fun when you are preparing. Share the plate as we showed you a while ago. And they can even sort of like point out and say, well, I like this, I want to try that. You can come up with names such as power beans. We're going to have some power beans today. And or it's time for our dinosaur tree broccoli. And or you cut the carrots in circles and you play with the food on your eyes, and you can make it up nicely on their plates. and put a circle for the eyes, and put a bean in each with a portion of the peas on the side. Just make the plate quite interesting, that they would really have to stop and think, oh, this is food, and encourage them to eat it up. So we want to also lead by examples as parents, teachers, guardians. That eyes are all on you. And if you see your children trying to eat you want them to eat certain foods, and we need to mirror that. And so what they see us do, they will want to do it as well. One of the things to keep them all focused is to watch the screen time, the amount of time that they spend on screen or any electronic device, because that as well tends to impact their moods and behaviors. So to make the environment more calm, relaxing, you can also play instrumental music, and that's calming in nature. And even adult instrumental music can still reach children. I have a niece, she is 3.5 years old, and she sings hymns. If you ask her to sing a song for you, she will sing hymns and sing it in the fullness of the verses and know the words for it. And it's because her parents, will just be singing hymns to her. They're combing the hair, they're singing hymns, they're doing some chore and activity around the home with her, and then even the dad is like singing hymns to her. So she grew up learning that, and know hymns more than children's songs. So if it is that you're even playing instrumental hymns, or soothing instrumentals, soothing hymn songs, even that can be quite calming to you as the adult as well as to the children. So as opposed to some of the childhood songs that can be, all wiki wiki wah, and tend to get them really hyper. Okay, so get your children involved, by help, they can pick a new fruit, a new vegetable to try each week. Let's try something new. You keep coaxing them, and soon enough, you move from one stage to another as they develop, as they improve and grow. You can start with the tomato plant on the porch and have your children water it. And soon enough, it would be a fruit. And could we taste it? Yeah. And if we did that, it's going to help. Assign age-appropriate kitchen tasks to everyone in the kitchen. And so as they grow older, you'd be able to engage them even in the meal preparation. So focus on the whole foods. Let's look at the colors of the food. And we can always season these foods with the varied herbs and spices to enhance their flavor. We want to look for nutrient-dense foods, foods that are rich in antioxidant. Again, that's going to help them to improve their immune system, their gut health, can speak to their brain health. So vegetables, we're looking at dark leafy greens, such as spinach, kale, arugula, broccoli, carrots, beets, onions, celery, cauliflower, sweet and white potatoes, or even purple potatoes, green peas, cabbage, and more. All of these are different items that we can have. Fruits, you have a variety of fruits, apples, bananas. Bananas are also great in potassium and magnesium. You want to get magnesium even in your zinc, in your pumpkin seeds and so forth, in your nuts and your seeds. But grapes, citrus fruit, berries, peaches, pears, pineapple, kiwi, plums, watermelon, starfruit, mangoes, peppers, tomatoes, cucumbers, squash, zucchini. A wide variety of fruits, savory as well as sweet, and colors that you can see even here. Whole plant foods for fats, such as avocados and olives, and Legumes are peas and beans, including your kidney beans, pinto beans, white bean, black bean, lima bean, black-eyed peas, garbanzo beans, which would be chickpeas, split peas, lentils, edamame, and tofu. So many varieties of legumes that's nutrient packed. And we have the nuts and seeds that we can incorporate in our meals. Almond nuts, pistachio, walnuts, nut butters, and pumpkin seeds, sunflower seeds, chia, and flax seeds are also other ways of getting varied nutrients that we need in our diet. We want to look at whole foods, and the whole food does not just mean rice, brown rice, but there are other types of whole foods that we could incorporate. And again, as the autistic child taste buds begin to improve and that they're more receptive to different tastes and textures. So just expanding, once in a while, checking and seeing if they are ready to take on different types. And amaranth, barley, buckwheat, bulgur wheat, millet. They may like popcorn, rye, quinoa, whole oats, and whole grain bread, tortillas, and cereals or flours of different types. I think I would remove rye from here, particularly when dealing with autism, because we want to get the gluten out, right? And then drink water. Yep, if we can encourage them to drink lots of water, that's going to be healthy. To keep that brain hydrated so that it can function well, but at the same time to help them to get away from the sugar and and all of those artificial colorings in those artificial juices. So if they can drink more water, that would be good. Then let's look at some breakfast options. Okay. All right, so breakfast. Okay, so I see a comment here saying, where Ms. Green is saying her client's behavior mimics drug addicts when screen time isn't well managed. Even the parents reported the same. Wow. Okay, so as we can keep them away from the screen better. Yeah, because the screen is designed to impact the brain and it can really cause situations to go out of hand. What is good for dry skin on baby just turning 5 months? All right, so all what we're discussing here, in a 5-month old baby, you find that the mom will have to make the changes because ideally the baby should be breastfeeding still. And question to Ms. Cheryl, AE, is the baby breastfeeding? If you can give us some feedback in the chat, that can help us to answer you better. Is the baby breastfeeding? All right, so what can we have for breakfast? So oatmeal is a nice item that you can get. Again, you're looking for fiber, you get more fiber in the oatmeal. And that helps to improve the gut health because you're feeding the gut microbiome with fiber, and it can help the child to stay full for longer so that you avoid having to snack in between. That oatmeal can be powered up with varied seeds such as chia. You can have mashed banana or pieces of banana chopped up in there. You can add almond butter, blueberries. You can put apple slices or kiwi or raspberry, as you see. Any mangoes, you can top it up with mangoes or pineapple, and that can help. Pineapple slices, or you can have apples, and then you can have an oat bowl like this. You can also have pineapples or bananas. You can take your bread, gluten-free bread, and put a nut butter on it, such as almond butter. You can put the the slices of banana and top it up with raisins. So it gives a nice sweet taste, especially with the nut butter on there. And in this way, you're getting a sandwich, yes, but it's so nutrient rich, and this could be helpful. What could you have for lunch or offer them for lunch? Quinoa, steamed carrots, and lentils. That you can also have another lunch meal could be baked sweet potato with sauteed zucchini and red and bell peppers and chickpea stew on the side. So really nice balanced plate of getting your carbohydrates, your protein, and your sauteed fruit items. What could they have for supper? So if they ate a nice bowl, a nice healthy hearty meal like this, and granted that they ate up well, then you can have a lunch that's a really nice balanced meal. And then you can have your fruits in the evening. So a suggestion can be like gluten-free crackers with hummus, a fruit kebab. I forgot to put my picture of my fruit kebab. And then you have your bananas you can eat in the evening time, or even apples or a handful of blueberries can be helpful here. So these are more in the evening for supper, having some fruit, or if you had some form of crackers or grain with legumes such as hummus, that's nice, simple, easy to put together. Okay, and so those are the diet recommendations. We also look at having some lifestyle recommendations, and that is keep focused on the diet. Don't let that drop. Again, whatever you can put and get your child to consume that is healthy, and at least it's going to be helping, and that's fine. So you also want to have established routines. So one, we move away from the screen, but also you need to put them to sleep by a certain time. Work with them to have their meals on routine timed basis, and then the sensory play that they would gain from therapy that you continue at home. Outdoor time and movement therapy. Children love environment, and if you can get them to interact with things in nature, that will sort of open up their senses more, because as they interact and it's in play form, and it becomes quite normal, natural to them. But there's so many sensory inputs with just being out in nature. The temperatures, you see the air that you inhale. You're in nature, you're looking at a tree trunk, leaves and the flowers and the grass on the floor. So there's so many different points there. Getting direct sunlight can help them, again, to improve gut health, brain health. Sunlight deficiency can be one of those contributory factors to poor health outcomes. And allowing your child to play and perspire, just, to get the body so stimulated and worked up in a positive way that can help with promoting improved health. Trusting in God, emphasizing faith and family support and hope goes a long way as we put our best foot forward and make our endeavors. So we want to also, promote that, having our child, teaching them how to pray, teaching them about God, may be abstract to them, but again, that's sort of stimulating that part of their sense. And then reading Bible stories, getting them to listen, to read stories to them, which can expand their imagination. And the more we do it, the more you nurture that, and that's part of their development and recovery. We also want to remember our caregivers, so it can be quite challenging to parents or guardians who are taking care of these children. And if you can help them in any way, that would be helpful. that to help them to get some balance with their lives. So here are some nutrients that you can look at in supplemental form. Probiotics and vitamin D3, vitamin B6 and B3. B6 for working on their moods and so forth. B3 for more calming, especially if a child with autism or other types of neurological problems, if they are very hyper, or sometimes there are children with additional situations where they can be aggressive. So B3 tends to come in nicely there for that. Magnesium is quite calming. Magnesium glycinate, if you needed to get any from a supplemental form for children. And zinc, again, because of the magnesium that it contains, getting pumpkin seeds into their diet can be helpful, even if you have to blend the seed and work it in within some drink that they may be having or something that they're scooping up eating. Omega-3 fatty acids, there you get in your chia seeds, flax seeds. Again, you'd need to blend that in to help them to consume it. However you get it in, that's good. And certain teas can be quite calming. Chamomile is good. If it is that they are allergic to ragweeds, then chamomile will not be recommended. But lemon balm, it's helpful for calming, reducing any form of anxiety. Lemon balm is a tea that you can make and have them drink just as they would drink water, and it would be helpful to them. Okay, so let's have our recipe for the week, and dates and nut balls. So part of getting our children to eat up snack time foods, we can have them eat. You can make this, so you can get your dates, nice jewel, fruity dates, so you can work with it. 1 cup of pitted dates, 1/4 cup of raisins or currants, 1 cup of pecans, and shredded coconut is a nice option, and some soy milk. So you place in the food processor these items, the dates and the raisins or currants, the pecans, and you sort of get it all broken down. Then you can add your shredded coconut in there, and you put some soy milk, not really a measurement, but enough so that it gets everything moistened. Not liquidy at all, but you want to moisten this so that you can squeeze it and form some balls. You can also save up some of the shredded coconut to roll that ball in, and so you get the shredded coconut on the outside of it. I do have another one, baked tortilla chips. So here you buy a packet of tortillas. It could be corn tortilla, that's what I like to get. And then you cut it down the middle, cut it across, and then diagonally both ways, and you can get your different quarters and wedges. You put that in an oven on 350 degrees Fahrenheit for about 4 minutes on each side until it's crisp and cool. And voila, you got chips. And you can put that with a nice guacamole, avocado dip, or hummus and eat it. Another one is the fruit kebab, where you can wash your fruit, cut it up into bite-sized pieces, and the child can make this, you can have them make this together with you. And the thing is, if you get them liking these foods that are quite nutritious for them, then they can have it multiple times and it would still be getting the nutrients in. I like to do this, you can do this with fruit that's quite fruity, or you can also do it with fruit that's savory. And let me just pull up my pictures here to show you. Okay, so I'll just pause for a little bit. Let me pull the pictures and share the picture screen. I actually, just let me go through. Oh. Oh my, it's not, I think because I'm on the Zoom, it's not allowing me to get my pictures across. Seeing it. Okay, so I don't know. Okay, I will post it in the chat. I'll post it. You can see a little bit. Okay, sorry, I didn't get to do this before, and so this is one of the kebabs I did some time ago, and I'll post it in the chat. So this one contains of tomatoes, cucumbers, pumpkin, and tofu. And so the tofu was baked, and so it's quite crispy and nice. And so we sort of like put the tomatoes in the oven and the pumpkin. So the pumpkin got tender, and the tomato got a little roasted. So we sort of had tomatoes, pumpkin or squash tomatoes, and a raw cucumber, and then the tofu, and sort of build these kebabs. It was really tasty and nice. And we had hummus as the dip to go along with the wedges of the tortillas. So what I'll do is that I'll post it in the chat afterwards on a WhatsApp group chat. Okay, so we're almost there. So that's our kebabs. And I just want to share for those who are listening and interested in more children's content on our website, we do have Health with Auntie Natalie. And I will share this YouTube link with you in the chat so that you can go on. And there's a nice way for us to incorporate children. Even if your child is not autistic, you could have children and teach them about healthy principles. So this is a series for children with it prepared for them, and it's quite enlightening. And in this one, there's a fruit kebab as well that was done. This is my nephew and myself. All right, and so scripture of the week, Matthew 19:26, with God, all things are possible. Okay, with God, all things are possible. So if you want to reach out to us, this is our connection here. 1-868-724-4898, 1-868-367-3165. And to connect with Miss Green, she's placed her number in the chat. It's 1-868-792-2289. 792-2289. Okay, so okay, let's see. All right, so to the question, yeah, she's breastfed for the baby at 5 months. So good. So the mommy would just need to have some nice healthy fats in the diet, the avocado, olives, nuts, and seeds, so to help to get more fat content into that milk. But it's summertime, and so you'd find that the skin tends to be more dry, and it's the first year of the baby's life. So keeping indoors can be helpful. I'm not sure what baby lotions that the mom might have that's using that may or may not be helping. But if the mom is more hydrated, keeping very hydrated, that's gonna helping as well with the baby. I know for adults, there's a vitamin E cream that I would use. You can try that as well. Vitamin E on the skin that you can get. There's the all natural vitamin D. This is not a synthetic product, so you would need to look for it online or on the in your health food store, and just test a little piece on the child's skin and see how the child responds to that. But there are these, sometimes for some skin types, the oils don't agree, and so you find lotions might more agree. Okay, so Sister James, you've invited Lily. All right, so let's see, reaching out to Sister Lily. Welcome, welcome. So we may have individuals here for the first time. We want to welcome you to our forum, and we're here every Monday evening. Okay, so do we have any other questions for what was discussed this evening, as well as for Ms. Green's presentation today? Okay, so if no further questions, we want to thank Ms. Green for coming forward and presenting to us this important topic for us to understand more about autism and to understand the children within our midst and how we can better support them. And we do look forward to when we do meet any child with autism, that we're able to share with them some more tips and to understand them better and to work along with them in a more positive, progressive manner. Thank you so much for coming and sharing with us. Right, so thanks everyone. And let's close out with a word of prayer. As usual, this session has been recorded and will be posted on the YouTube channel, drnatalienash.com. And if you, the invitation that went out for tonight's program on that's shared around in the WhatsApp, it also carried the WhatsApp group for the Monday Night Live sessions. And if you joined that, you'd be able to get access to the links as well as the phone numbers, follow on, and any information that we'd share with you. Even the recording would be posted there. Okay, so let's close out with a word of prayer. Heavenly Father, we give you thanks for this day, and we thank you for the information so that we can understand more about the little ones in our midst and how we can best help them, take care of them, and respond to them in a healthy manner. And we pray that as we do our part in their growth and development, that your love will be extended. We ask for continued grace to be with us in the remainder of this week. Be with each of our attendees and those who would yet listen online. This is our prayer in Jesus' name, amen.
Thank you, Dr. Nash.
Okay, thanks.